want to welcome you to today's DRISS Presents TEACH-RS presentation. Just to throw the plug in, DRISS-RS, TEACH-RS, this is a monthly lunchtime presentation that we have. Today we have Dr. Mora Pinzon, who will be presenting, and then we also have a presentation in April, and then our last one for the series will be in May. So this seminar series is open to everyone, and it also fulfills the requirements for the Implementation Science and Community Health Outcomes Certificate. So Dr. Mora Pinzon is a physician scientist, board certified in preventative medicine and public health. She earned her medical degree from the Universidad, I'm going to kill this pronunciation, Maria, my apologies, Central de Venezuela, Escuela Jose Maria Vargas, and a master's degree in clinical research from Rush University in Chicago. In 2017, she completed her preventative medicine residency at the University of Wisconsin-Madison. Currently, Dr. Mora Pinzon is an assistant professor on the tenure track at the University of Wisconsin-Madison, Department of Medicine, Division of Geriatrics and Gerontology. Her research focuses on improving healthcare access for patients with dementia and their caregivers, particularly within the Latino communities. Dr. Mora Pinzon has held leadership positions in several medical organizations, currently the National Hispanic Medical Association, the American College of Preventive Medicine, and the Medical Organization for the Latino Advancement in Wisconsin. She is the chair of the Health Policy Professional Interest Area of the Alzheimer's Association International Society to Advance Alzheimer's Research and Treatment, called START. She leads multiple research projects in implementation science, health equity, and health services research, including serving as a principal investigator of a K99R00 grant from the National Institutes of Aging for her project, improving access to Alzheimer's disease and related dementias care services for the Latinx individuals at the community health clinics. So at this time, I'm going to turn this over to Maria and let her do her presentation. If you have questions or comments, please use the raise hand feature and wait to unmute until we are able to call on you. You're also welcome to use our chat features and also put questions there. So turning it over to you, Dr. Pinzon.
Thank you so much, and thank you everybody for being here today. I know the weather is very nice if you're in Madison, so you might be like thinking, oh, maybe I'm gonna go for a walk, or maybe I should do this presentation, but thank you for spending the time with us. So today I'll be talking about a few of the things that my team, we have done, and with the picture of us is in the chat, so none of this work could be possible without them. But let's just start with a quick poll. Just help me to see where we are. So let's see. Answer as many as you think are important. We're gonna give them just 10-15 seconds. So when thinking about recruitment, what is more important to you? The quantity, diverse responses, representative responses, or other? And if you pick other, I would love to hear in the chat. So we'll wait 10 more seconds. And well, we finalized that. A couple of disclosures from my end. So know that some of the work that I will be presenting today, some of them has been funded as a REC scholar from the Wisconsin Alzheimer's Disease Research Center. Some of them is coming from my NIA K99R00 grant, but also work that has been funded for the Wisconsin Partnership Program and internal grants from the Department of Medicine. Can we see the results of the poll before we move forward?
Quantity is at 13%. Diverse responses, 46%. Representative responses, 90%. And other is 3%.
Thank you so much.
I will leave this open for a couple more minutes. There's a few more people joining.
Perfect. So today the objective is to understand some of the unique challenges and cultural factors that impact recruitment, but also assess the effectiveness of different recruitment strategies. But above all, learn from my mistakes. Please, 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 please. I'll show you really the good, the bad, and the ugly, and happy to answer any questions. Let's start with the first one, the most basic one. Who is Hispanic or Latino, Latina, Latine, Latinx? According to the census, Hispanic origin can be viewed as heritage, nationality, lineage, country of birth of the person, or their parents or ancestors. So this is how far we go down in our history. It really depends to each person. But although we sometimes use the word Hispanic and Latino as interchangeable, they are not. Hispanic refers that they speak Spanish or that their heritage comes from a country that speaks Spanish, while Latino refer that they are from Latin America. So from the south border of the United States all the way down to the bottom of Chile and Argentina. This also includes the Caribbean islands. So then when we put this into this Venn diagram, who is Hispanic and who is Latino? The only country that's only Hispanic and not Latino is Spain. But we have many countries that are Latino but are not Hispanic. And I think this is one of the reasons why I usually refer to maybe Spanish-speaking Latinos. Because, for example, Brazil, French Guiana, Guadeloupe, Haiti, Martinique, Saint Martin. Oh, thank you. They are all Latinos, but they are not considered Hispanic. Their primary language, for example, Brazil is Portuguese, while some of the other ones might have French, French Creole, or other variations. But one of the things is that no matter the term that you use, you need to understand what it means. So, for example, most recent years, we have used the term Latinx. Latino, male gender, Latina, female, Latinx, or Latine are gender neutral. Just understand that in Spanish, everything has a gender. If you say the chair, la silla, that is feminine. Yes, it's an inanimate object. We still assign genders to it. So that's one of the things that make it very hard to have gender neutral language in Spanish. So what happens when we introduce the words Latine or Latinx? We have received a lot of pushback. So, and these are just some of the headlines. About 1 in 4 US Hispanics have heard of Latinx, but just 3% use it. For most Latinos, Latinx does not mark the spot. Why are people split on using Latinx? One of the most common objections is that Latinx is not a sound, the X at the end is not a sound very common in Spanish. So that's why Latine has come from. The E, in this case, at the end of the word is neutral. So what word should you use? It depends. Honestly, it depends. So according to multiple research studies, most people, if you ask them, what would they prefer to identify their identity? Over 50% of them say, I would like to say my country of origin or heritage. And the same way that we have people saying, I'm Italian American or I'm German American, I'm Mexican American, I'm Puerto Rican. They rather use that country, the smallest, the closest to who they are to describe themselves. 23% will use Hispanic or Latino, and 23% will use American. Now, when we ask them about Hispanic or Latino, 50% will have no preference, but about 30% might prefer Hispanic versus Latino. But these numbers are from 2015, and they are generational dependent. If you ask older adults, they prefer Hispanic by a long shot. Some of them are still using the word Chicano, which is from the 70 census. But if you are the younger generations, they might be more comfortable with Latino or Latina. So whatever term you decide to use, be prepared. In one of the studies that I'm going to show you, we used all of these words in the flyer. I swear to God, all of them were there. And I will receive this email from somebody. I'm Hispanic. Latinx doesn't exist in Spanish. No one in my family uses the word. I'm offended. So again, this flyer went through multiple revisions, have all of the terms. It says Hispanic, Latino in the top. It says Latino, Latina in the middle, and then have Latinx in another part later. That was enough. So you need to understand and asking the people that you're trying to recruit, what's their preference? With that in mind, other cultural considerations, and I think a lot of people always when thinking recruiting Latinos, they were thinking about the language, and that's why we might see very commonly things like Spanish is not we do not have capacity to do Spanish. The question is, do you need to? Understand that 50% of Hispanic adults or Latino adults in the United States speak English as the primary source, 50% of them. 21% uses Spanish and 23% uses both. They might be in different settings and locations. Again, this is generational. You see that the ones that were born in the US are more likely to be using both or English. Meanwhile, those that are immigrants are more likely to using Spanish. And again, based by years. So I work with older adults, so that the number of older adults that speak English very well is just 35%. So depending of the group that you're trying to reach, their language, their Spanish preference might vary. But that's not the only thing that really prevents participation of Latinos in research. We know many things. So these are just some of the ones. Transportation. In a recent survey that I analyzed from the BRFSS, the Behavioral Risk Factor Survey, about how many people had transportation issues to get to healthcare services, for Latinos, that was 20-25%. The transportation is the most common thing that is mentioned about an issue for participating in research. And we'll see a little bit more about it in one of the examples. But also, many people, particularly, again, older adults, we work a lot of them, they depend on somebody else. That comes the after hours. Is there, do you need to wait for somebody to bring you to the appointment? Do you need to bring your kid to the appointment? Maybe you are the one responsible for childcare. Work responsibilities. When you have a population that might have a lot of third shifts, a lot of different schedules, it might not be as easy to find a time to participate in research. But now let's go to the examples. This is where I think the meat is. Remember, the goal is for you to learn about my mistakes and ask as many questions as you have. Let's start with different approaches. Mail. I loved this idea a lot 5 years ago. It's something that you get to your house. There's no transportation needed. It's something that will give us representative sample of the population. And at the same time, there's a very specific process and we have very good experts in campus. So I work with a survey center on this. We mailed, sorry, there's a typo there. We mailed 750 surveys to individuals in Madison and Milwaukee. We work with the survey center. We identify census blocks with high proportion of Hispanic or Latinos. That was very easy in Milwaukee due to segregation and a long history of redlining, but in Madison, it was very hard to do. In many of the Madison census blocks, the maximum number of Latinos per census block was 10%. So that was very hard to do particularly in Madison, but other cities, like for example, Chicago, is also relatively easy to find. Now, you might be wondering, how do they know about Latinos? Well, again, census blocks. But the other things that we use in the addresses, there's a lot of things and a lot of imputation and a lot of lists out there that based on the last names used, the neighbors and other things that define who the percentage of households in that census block that might be Hispanic or Latino. So we sent these 750 envelopes, one survey in English, one in Spanish in each one of them. And this was a 4-page survey. We sent 2 postcard reminders. And in the first envelope, there were $5 cash, 750. When we did the study, it was, again, fall 2021. By then, the typical response rate for this type of study was about 40 to 50%. I did a calculation and say, okay, let's say that I get a 35% response rate. How many will I need? Okay, I need this amount of surveys. So let's see what was the result. We got 117 responses at a 6.6% response rate. And only 44% of those responses were Hispanic or Latino. Again, we sent only 50 because of the difficulties on identifying where are the Latinos in Madison. We only sent 50 surveys to Madison. We sent 700 surveys to Milwaukee, where we felt very comfortable, and since some of the census block had over 90% Hispanics. Only 51% of responses. But there was an interesting 10 responses that did not select Hispanic or Latino, did not select race or ethnicity, but they fill it out in Spanish. Now the question is, should I count those people as Hispanic or Latino? Yes, no, maybe. Food for thought. What happened? Of course, we need to do a postmortem of this. After talking to other people, confusion about why we reached out to them. There was a letter included saying that, hey, we just got your letter from the post service or this, we don't know anything about your medical history, anything like that, but this is a survey to know about this. Still, there's confusion, like who you are. I received one phone call from somebody like, I don't know who you are. Please stop mailing me things. This was right after the second reminder. I don't want to participate. I had no idea who this person is. But then many thought that they were being targeted. Confusion on how to return the survey, prepaid envelope. I'm gonna share a personal story. I moved to the United States in 2010. I did not learn the goal or how prepaid envelopes work until 2018 easy. What you might assume is obvious might not be for an immigrant. A lot of people might think that they still need to put a stamp on that. People didn't feel confident on answering. I didn't want to make a mistake. We have heard this in multiple work study surveys. When you have a survey that somebody needs to fill out on their own, they have a tendency to say, I do not know enough about this topic, so I'd rather not respond. Or in this case, even though we say multiple times, there's no right or wrong answers. We just want to know how you think. Still, people didn't want to make a choice. One of the comments that we received from the same survey was that people wanted an I don't know option. We received that one multiple times. They felt that that would have given them an out to fill out the survey, but still being able to answer just the questions that they were comfortable with. Alternative to mailing. And I want to highlight, this is from the survey of the Health of Wisconsin. See, this is a news article from 2018. So they had the same issue that I did many, many years ago on trying to identify getting people to respond based on the census block. Because who are you? Why you're calling to my house? Same thing. So they started to do in 2018 a pilot for a snowballing recruitment. So they partnered with United Community Center and other organizations in Milwaukee to do more direct approach, being a health fairs, being at different events, and invite people personally. And then through that, they invited other family members and other people. They did an analysis that I don't think it has been published yet, but they mentioned that the characteristics of the recruitment based on the snowballing versus what they would expect based on census characteristics was very similar. Yes, there was a higher degree of relationship because, again, we will go in by family members or other people that you might know, but still good enough to give a representative, a good or close to good representation of who are the Latinos in Wisconsin. Another example of the issues that I have had using mail. I did a study where, again, this was in the middle of the pandemic. We couldn't meet in person. We were doing interviews. And then I needed to share these postcards with people because it was about, tell me what you think. What are the things are similar? So I need them to see this, to have them in their hand, to play with it. So the way that we planned for it, and I think we did pretty good. We sent this by mail. In 4 or 5 of the cases of people that I was trying to invite, I had to send this letter 4 times. Why? They were interested in participating in the study, but they didn't have access to the box, to their mailbox. They were in a rented apartment. They didn't know how to open it. Another group, they were living with their sons or daughters and say, I don't know, they haven't given me anything. So some of them were moving or like, oh no, I'm right now visiting my son or my daughter in Texas. So it was an issue getting these documents to people. And I've seen that sometimes people might say, oh, well, we just send the consent by mail and we'll get it back. Like, good luck with that. Again, same thing, prepaid envelopes, people might not know what they are, might not know how they work, might not have access to the mailbox, or they think they might have access, but it turns out that there's some sort of other error. A couple of the times that I sent mail-ins, it was an incorrect address. Again, and I confirmed with the person, and that's the address that they gave. So that's another issue that I have with mail. Now let's go to another tactic that I know everybody, if you have not tried, you have done. Again, this is my team. Please shout out to Javier, Carmen, Susie, and Valentina. We go to fairs and community events and other outreach activities. So let's talk about that. I'll give you examples. Brain Health Registry. This is a study led by Dr. Andrea Gilmore-Wyskolski in emergency medicine. about a couple years ago, we started trying to recruit Latinos. So we have gone to a couple of different variations. I want just to highlight, this already starts from, I'm showing you the English flyer, but we have the flyers in Spanish, all of the surveys are in Spanish, all of my team speak Spanish, and then we have a phone number where people could call us so they don't need to access the computer. We've been in multiple events, at least 15 events since the spring 2024, when we actively started recruitment. We're really pushing this forward. And we have recruited one person. Again, there's a lot of things happening in the world right now, but I was expecting a little bit more. So again, let's go to the postmortem. What's happening here? Confusion about the term registry. And this is a fight that I have had. You see in the flyer, join our brain health community registry. The word in Spanish is registro. Registro is a place where I go with somebody at least in Venezuela, go to register the birth of their child. Registro has very connotational, like administrative, legal implications. There's fear around the word registry. It's fear of that I'm in a list, who will have access to the list, who will be coming looking for me or some of my family members. Lots to follow up. We have had many people interested, like, oh yeah, let's talk about it. They give us their phone number. After multiple phone calls, there has been no way. So we have had at least 5 or 6 individuals that have completed the first half of the survey and say, yes, call me to go over the rest and find the consent. No way to reach out to them. They're busy, they don't have the time to stop responding to our phone calls. But above all, not enough time to explain in the tables. And this is one of the pictures of one of the events that we went. When people is, in many of these events, people is in a hurry. They're just coming, grabbing what they can for the table, maybe giving you 1 or 2 minutes, explaining the registry and what it means being part of the registry. Even we don't do blood work, we don't do tests. We just like, hey, just let us give us your name and we'll reach out when we have something or a specific projects and we'll send you information about health. It's just not enough time. Some of the questions I have received is like, do I need to pay? Or the question is like, oh, is this for people with cancer? Or can you help me if I have cancer? So there's a lot of implications that there's not enough time to explain in those community events. Now you might think, okay, let's do a community event when that's the main topic, we have the time, we organize the presentation so that everybody knows about it. I love the idea. We try something slightly different. So this is work that we've been doing with the Swallowing and Salivary Bioscience Lab from PI is Dr. Nicole Roguspulia. And this event did not have the intention to recruit for studies, but it was just an outreach event. We have been working with the Latino Health Council for many years, and one of the first things on organizing the event is making sure it does not conflict with other things that are happening in the community. So it requires a lot of effort. For this event, it was just an educational presentation, an hour and a half, like 45 minutes of the presentation, dinner provider, transportation provider, and just making sure that people feel comfortable. Doing a calculation, we spent about 240 hours of staff time on planning this. Why? Well, one of the main things is that this was directed for older adults. So we needed to do phone calls to invite them, a couple of phone calls to organize the logistics, and then one phone call the day before to make sure that they were ready and that they had no questions about how to get there. We had 60 people registered. 45% of them were contacted personally. We called them. They were part of the senior group. They gave us permission to call them, to invite them to participate. We provide transportation for about 42 of them. And then we had another 15 registrations from the flyers or from like family members that they know about it. At the end of the day, the 15 people that registered from the flyers that were not provided transportation, one of them showed up. So we had only about 44 people showing up for the event. The 44 were those that we called, we contacted personally, and we provided transportation. And that was key. Only a handful of these individuals would have arrived to this event if it were not for the transportation. But as you know, it takes a lot of effort. One of the things that we learned is that the drivers of the vans do not speak Spanish. So what happened? Many times they were not able to explain who they were or why they were here. So we had somebody troubleshooting and over the phone, calling each one of the persons saying, yes, that's the driver. Yeah, go with them, and try to be working remotely in getting them to the van, even though the van had a little sign saying that they were coming to this event. So it's something new for most of the seniors that they have never had in transportation in this type of van. So something of the things that we will do next time that we do this is that having a volunteer in each of the vans, making sure like that can speak Spanish to help the seniors getting into the bus and calling the door and making sure everything is okay. But there's something else about the personal contact that was important here. And I mean it extremely important. We send this through the invitation, general invitation to a couple of WhatsApp groups where we have partners and collaborators. And here says, hey, name of group, we hope that you're doing good. We're writing to invite you to this event that we have been organizing. Let us know if you need more information or if you need assistance. General group invitation. The day of the event, a couple of the people in the group couldn't attend. One of them told us like, no, I'm sick, I won't be able to make it. The other person, we never heard back, which was surprising to us because this person is always very engaged. After going back and forth and say, okay, what happened? Are they okay? Is there anything, is anything happening? And then we learned that they didn't know this event was for them. Even though we sent in the group, it's a group. So they were not sure if this was for them, if it was appropriate for them to attend. And at the end, between the busy of life, they didn't reach out. So this was like, we need to make the personal invitations, not just, hey, there's a flyer out to a group of people, but really personal invitations to everybody involved. Furthermore, is a community event a correct place? You know, that's part of the conversation. This is the advisory board that we have of all the adults, well, part of the advisory board. And then one of the first questions that I asked is like, hey, should I go to a community event like the Fiesta Mexicana or Independence Day party or some other fair? And they said, well, no. We're going to those events to have fun. We do not want to be thinking on hard things or health things because that's not where we're coming from. So again, I work in dementia and Alzheimer's, so there may be something about the stigma related to that. But they were very, very interested in that. Is this a sensitive topic? I don't want to be talking about that in public. I'd rather small group discussions. I'd rather a smaller events, something that we can really ask the questions and really learn more about this. So that leads to the next point of who can help us to build those partnerships to really be able to have those little groups. What resources do we have? Again, I have been in tables where we are talking about brain health, sleeping, and other things like that, and I get questions about cancer. Or I get questions about, oh yeah, my mom has this very rare disease, is that dementia? So it's important to understand what people is gonna ask and be prepared for those questions. And I make a note here that is, please, please, please do not drop flyers without having a collaboration in place. In one of the events that we were at, we had a table, we were doing some screenings. Somebody say, hey, do you have somebody dropping flyers? I say, what? No, I don't, I have everything with me. So somebody from the university dropped some flyers and say, hey, could you pass this around? We don't know who this person was. We don't know what the study was. But that's one of the things that when that happens, it affects the reputation of everybody. Again, at the beginning, somebody thought that they were with me because I work with the university. But if I were not there, somebody might mistakenly assume that it was me who sent the flyers, I was not there working. So this is very important, that just because our community event is in place doesn't mean that we can do recruitment in there. Another approach, promotoras or community health workers. So the community health workers, these have been used for research recruitment in multiple places. I'll share my experience personally. So again, the same survey that I've talked multiple times. For that study, we recruited 1,000 people around the United States, all of them Latino. We worked with a promotoras group in LA. They were interested in the topic, and we have we developed a partnership, a collaboration for this project. They were able to recruit 309 people in a month. The promotoras, how they did it, the promotoras, they had a little first presentation. This is what the goal of the survey is. This is what we're looking. Each person that completed the survey had $15 gift card. And then the goal for them was to recruit 10 people each. And it was a group about 15 promotoras. So they went above and beyond those 10. But I want to highlight something. The group that the promotoras reached is not the same that was reached by the rest of our sample. Our sample was about, of those 700 responses, 500 were online, 200 were in other person events that were, or other activities here in Wisconsin or the Midwest. The promotoras were able to reach mostly people in the middle age group, 26 to 64 years old, but also mostly people with no formal education or below high school education. And that was huge. Only 54% of the Latinos have a high school degree or lower. So we're talking that the ones that the responses that the promotoras got were closest to the national average that when we go through our other survey responses. Most of the people that fill out the online survey had a college degree or some college experience. Compare that the promotoras reach out really to those that are not comfortable using technology. And one of the things that they said that it was very clear is that what I mentioned before, people were afraid of making a choice. They needed the promotora to coach them and say, hey, it's okay. What would you think it is? No worries. It's not right or wrong. That was huge. Yes, that makes the survey longer, but that was key in getting people engaged in the survey. And then after the survey was complete, we did a whole presentation, educational presentation to the promotoras and sending a lot of information that they could share with all of the participants. The participants are people that they know, are the neighbors, are their family members, are people that they can reach out multiple times again in the future. So that's another way that we are sharing the results with the promotora so that they can share with the community and say, this is what we learned thanks to you. Now, since we're talking about social media and the 50% of the responses were from college educated and above, a couple of things. Social media is very important in the Latino community. In 2024, Pew Research Center did this survey about how frequently do people use different social platforms. I want to see 86% of Hispanic use YouTube more than every other ethnic group minus Asian. 66% of use Facebook. 58% use Instagram compared with 43% of white Americans. 32% use Pinterest. 49% were using TikTok, and 54% of them were using WhatsApp. If you don't know what's WhatsApp, we'll talk about that later. But I think this is one of the things that is hardest for me to use. WhatsApp is a messaging platform like you use in text messages. It's very common in the Latino community. We use it because it's free and we can really communicate for people around the world. But the main thing is not HIPAA approved. So we have not been able to use it for research, but that's an untapped market for recruitment. So this survey that we shared through the social media channels, we sent it between the first round went out in September 20 to December 2023, and we got about 2,000 votes per day. Yes, we had a CAPTCHA. That does nothing. After revamping, revising, and adding multiple security steps, the first step of security was doing a two-step process. So interest form, if you pass that form, then you get the final survey. We have multiple different security. This is just some of the most common ones. The CAPTCHA, that's useful, not bulletproof. We have exact sentence replication, which basically we ask people, hey, could you write this there? The thought is that the bots will fill out gibberish, but it hasn't worked very well, that one. We use Qualtrics, and that has a fraudulent score, and also there has another spam score that will alert of potential fraudulent responses. Mismatch in the name of the email. Sometimes we see John Smith, and then the email is a bunch of random letters. Response time and abnormal behavior. You need to see more than just, is this a response, yes or no? It's like, sometimes it's like you get 15 responses at the same time from the same browser, and they start at the same time and end at the same time. That's suspicious. But we have used social media beyond recruitment, and I invite you to look at this paper that we recently published as about the implementation of a social media strategy for health promotion. It's not just the message, it's not just what we share, but also who shares that. And that's something that we have used in recruitment too, in that same study. We use, because we were evaluating the social media use, we actually use the social media to recruit participants. We apply the same things that we have learned from previous study. Two-part process. Hey, fill out your interest form and we're gonna call you to verify that you are a real person and that you can come to the focus group. It actually worked pretty well. We had multiple responses from all of the communities that we're targeting, and that was very helpful. We had issues in following back. We tried to call back people multiple times, and that didn't work out. In the interest of time, this is just thinking about who invites or who shares in social media is very important. Working with the Latino Health Council, we have multiple different messages and approaches about COVID-19. And I just want to highlight this. A standard message was seen by 77 people. Again, take a look that this comes from the Latino Health Council. It's in Spanish. It has a link. It refers information. But then when the message is shared for somebody that people know and trust, the message exponentially goes out. This is one of our community members that she's a leader in the community, somebody that I admire and respect so much, and I'm very grateful for all of her support. She posted this picture of herself getting her shot. 2,000 people saw it. 232 of them asking questions, and the questions were, how do you feel? Where can I get it? It's too late for me. So when you have the support of somebody in the community, they are powerful allies. To summarize, overall strategies to improve participation. Establish trust with community organizations. Please do not be a helicopter or parachuting investigator. That means we need to be boots on the ground. We need to be there and the different organizations and understand what they need, or how they move, and how the community reacts in order to understand the best approach. Working with the communications also means identifying the right partners, people that understand the culture and the needs. So sometimes, again, I work with older adults. I have wonderful partners. But sometimes I have done partnerships with people that is not an older adult or do not work with adults, but they work with the sandwich generation. They work with the sons or the daughters that they take care of older adults. So the right partner might not be who you think it is. Keep the channels open and always report back. That's the main thing. I think one of the first times working one of the projects here in Madison, I was new in Madison. I started working on a project. I reached out to one partner for a study to give them updates, and they say, I haven't heard on this project for 5 years. Who are you and why you contacted me now? So please report back. Again, when one of us fails, all of us fail. Because people don't know how to differentiate between the multiple departments in the school. Keep your word. If you say you're going to do something, please do it. If you can't, report back and say, hey, things are changed. This is what's happening. I'll keep you posted. Research staff that look like us, and I'm very proud of my team and everybody that has worked with me. One of the things, and this is about, with all of the flyers, all of the things that I'm doing, we have multiple people looking at them. We have different points of view, and this takes effort. This means many times training the people in the job that we want them to do. I want to highlight the community advocates that was for our social media project. So these are community individuals, students, people from the community that did not have communications experience, but we hire them to, hey, share what's happening, share medically accurate information with the community in your own words. That means training on communication strategies. That means training on how to use Canva. That means training on multiple other areas. But had we only been looking for people with already the experience in what we needed, we might have missed their voices from the community. This is a given in the sense that we always have materials in multiple languages, but I want to highlight something about this picture. We use this picture to recruit for our advisory board. And I like the picture because I say, well, they look ethnicity ambiguous at best. So the first thing they say, I would like more pictures of Latinos. These are not Latinos. What do a Latino look like? I don't know yet. But according to CDC, this is how we look like. So make sure that the pictures talk about the different things that people care about. One thing is that the picture of the gentleman with the kid, that really reflects a lot of what we see in the Latino community of multi-generational households. So thinking about what your image is representing and do people feel connected to them? The little things, location, incentives, transportation, childcare, elder care. But one of the things that we learned is that make sure that your study includes the purpose, who will benefit and why does it matter. I know sometimes we don't want to give too much information to fear to bias somebody, but at least the Latino group, all of them want to know What are you going to do with this information? Why does this matter? That was key. And that's something that, yes, it takes 2-3 more lines of text, but people want to know that. Now we have time for questions. Thank you so much for listening. But then I have a question for you first, and I will ask everybody to prepare to write in the chat. So my question is, what are you afraid of when trying to reach out the Latino community? Take 30 seconds, and please, 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 that way we can have a good conversation in the next 50 minutes. Or if you have questions, let's talk about the questions. No questions, really? Hey, I know I'm good. I'm not that good. I know there's questions. Thank you for sharing the comment in the chat. I'm fearful of offending a person I don't know. I have the same fear every day, every time that I do a presentation in the community. I won't lie. Well, one of the things that I think for me has been very helpful is being open of this is what I don't know. This is what I'm coming to learn. And also I'm not asking questions like asking questions to learn, not only for this is the work that I need to do today. But that's also one of the things where having multiple people in the team that we could navigate this together. In Spanish particularly, and now this goes to the second comment, messing up language. In Spanish, the same word can mean multiple things in different countries. And half of the time, the other thing is a bad word. Like, I mean a really bad one. Example, the word for a jacket. In 3 or 4 of the countries, we use one word, and that word in Mexico means masturbation. So I have used it a few times before I learned that, but people only make fun of it and they say, yeah, you don't know, it's okay, this is what it means with us. Most people is very forgiving if you know that you're coming from a good place. Next comment, I'm afraid that they will come back with a question in a language I can't speak and I won't know how to answer and I won't get an interpreter fast enough. Thank you so much. And we had this happening to us. So one of the things, again, and this is open communications, we had in one of the events, somebody asked, do you have somebody that speaks Quechua? We were doing some screenings and do you have somebody that speaks Quechua? And the answer was, I'm so sorry, we don't. And we said this to the son that was there with the person. So we have come back. Most people understand when that happens. And there's a couple of things that can be done. So if you know that there might be somebody that you could get an interpreter later, offer a phone or a card or say, can I call you back once I have an interpreter? Or the other option is make a better plan for the next time. It will happen. It happens to us all the time. But again, we keep showing up. We keep going there. We keep making sure that we have additional resources. And most time is very appreciated. How do you check to ensure events you're holding don't conflict with community events? Great question. There's not one single board. So this depends of who are you trying to reach and what are they doing. So this is where partnership is key. For example, the Latino Health Council that we work with them very closely, there are 40 organizations that have partnership with them. So we usually check, okay, who knows anybody, and then check the emails or check the calendars for the organizations. But so many times, still, no matter how much we plan, still something would conflict. And it has happened with us with different events. So he's always asking extra questions and make alternative plans. Once I canceled an event because it was going to be at the same time of something else. We were early in the process. It was able to do it, but that's where having the multiple people engaged is important. Using the wrong terms language. Yeah, you saw the email that I received. Like, I'm offended. It will happen, but that's where, who are you trying to reach? We did our best. Now we use Latino, Latina, Latine, Latinx, all of the words. It is a lot more words, yes. But also every time that I'm going to start a project and I have a partner, I ask them, what term should we use? Many times I'm using just Hispanic Latino in my flyers, that's it. And it's been a very safe word. Can you talk about your budget for recruitment engagement? I'll leave that for a minute. I would love to hear more about where you recruit the advisory board and selection process. Great. So we actually did a calculation of our budgets recently. Where do I start? Okay, remember the event that I showed you where we provided transportation for people? The transportation for 42 people cost us about $3,000. The number of staff and all of the planning required, again, calling people ahead, inviting them, reminding them a week before, reminding them the day after, getting the food, having multiple people ready on the day. And I say multiple, we have 10 different people in the room helping people with registration, helping them people to get food, replenishing things, cleaning tables. We have at least 10 people. Between all of that, we spend about $15,000. A typical event, I'm saying like hey, there's a conference and I need to go to with a table and get in a couple of my team members. So we are there the whole event. That the minimum is about $3,000-$4,000, counting the materials that we have, the time that it takes to planning, because it's not only, oh, I just show up. No, it's like, what materials do I need? Let me order those materials. Let me talk to the partners, 3 or 4 planning meetings with them to make sure that, okay, what time do we need to arrive and all of the elements. So it really takes a lot of effort. So the recruitment of one participant, we have established that is about $150 at least in recruitment and outreach strategies for many of the projects. And of course, sometimes it's easier, sometimes more expensive, depending on what our incentives are. But this is where having a conversation with also the most cost-effective way for us has been partnering with somebody. In the sense that partnering is being on the events that are already happening in the community and not creating things of our own. That's been the most cost-effective. It helps to the organization to host their events, and it helps us because we don't need to do a lot of the logistics. And how do we create a space? How to create space among your team time to be able to do this? That's a priority of my team. So that's one of the main things. This is not an add-on. This is like expected, and that's been part of from the recruitment process. Hey, we might have some events, and yes, you're data scientists, but we might need your help in some of the events. And then we create that expectation from the beginning, and we make sure that then we allocate schedules accordingly. And that's why the planning takes time, because then we're planning a start a month ahead. It's like, okay, what other projects do we have? What deadlines do we have? What do we need to prioritize now so we're all able to attend this particular event? Our community advisory board. Community advisory boards, they were one of our community. Well, I'll backtrack because we have a paper coming on this. I've been in Madison since 2015. I've been working with the community since 2018. I did not recruit for the first advisory board member until 2021. I'm saying that they were already 4 years that I was attending events, volunteering, mentoring students, being part of the community before I recruit the first person with advisory board. That built a level of trust. Like, it's not just I'm showing up from the get-go, but it's like, hey, she's been here. She's still here. She's still showing up. So the first part was one of my partners. Hey, we're looking to do this. Who would you think is a good person? And that person leads us to another person and another person and another person. So the advisory board for us was older adults. So we're working with people that have been engaged to other older adult groups in Madison. But again, it's a huge part of this is that that was not the first thing I did. That was many years after. And we'll have a paper coming up, hopefully, soon. It was accepted, but it was accepted in a CDC journal. We'll see what happens. What platform is used when reaching out to community via text? Yeah, great point. I do not reach out via text because I do not have a cell phone provided by the university that's HIPAA approved. So ideally, I would love to send text and just regular standard text messages. But then we know we have rules about it should be one-way message. People shouldn't be able to respond. There's a lot of rules in there unless it's a HIPAA-approved phone. So I would love to be able to do a lot more things by text message, but we can't. In the project that we've been working with emergency medicine, they do have a phone that's part of the university that they can send out text messages, but that is even just limited to, hey, can I call you now? Not providing more information via text or anything like that. It's just the minimal amount necessary to be able to schedule an appointment. Do you have a separate program outside of Teams or WebEx or a program that's used to integrate that feature? Yep. No. But if somebody wants to teach us how to integrate that feature, I'd love to learn more. other questions? Other concerns? I know I've talked a lot, but if I could ask everybody a round of applause for my team, I have like 3 or 4 members here, and they're awesome, and this work could not be possible with them. Susie Fernandez de Córdoba, Maria Rosales, Javier Neira, Valentina Flores. So they are amazing. They're absolutely amazing. And yeah.
Maria, I have a question. So where did you arrange your transportation through?
So that was mostly done through the Swallowing Lab, and they really.
We have no sound for you.
Oh. Can you hear me there?
Kathy, can we make sure that she's not muted?
Okay, and the chat is saying they can hear me.
We can hear you, yeah. I think it's just you, Barb. I'll text her.
Thank you. So the transportation, so the Swallowing Lab did a lot of that heavy lifting, and that's why they were very important with that. So the first step for the transportation is that Madison does not have a lot of taxis. So looking for the taxi companies, there was not enough capacity to do all of these taxis in a short period of time in a cost-effective way. So there's a van service that were recommended by the university that we use. We have 3 vans that we schedule. Each one of them pick up about 6 older adults. And these were, but still, the first person that was picked up, that was in the route lasted about 45 minutes, almost an hour on the van. So that was very hard for them. So, but it was the most effective way that we could be able to track everybody rather than have individual taxis. But that's the hardest problem in Madison. Really, this is not an easy way. The Latin or partners in the community also have the same issues that sometimes they hire a taxi and they never showed up. It's very common. And do you think somebody had raised their hand to have a question?
I did see one.
About the slides, I think they will be available. I'm not sure.
We will have a recording of this presentation. So if someone wants to see the actual slides, they should reach out to us directly. We would need to get permission from Maria. But the recording will be available, soon, probably in the next week or 2.
Thank you. And I'll say again, learn from my failures. It's not easy. It's not easy. It's not easy. It's not easy. I will be lying if I say, yeah, sure, I can recruit you. No, I can't. It takes a lot of effort. And the hardest thing has been, even for studies that people is interested, is getting them to call you back and being able to match a schedule. And again, I offer interviews sometimes like afternoons, evenings, Saturdays, Sundays, you name it. And sometimes we have a time and the person is not available. Something happened. Sometimes we are in the middle of the phone call and they need to drop off. It takes multiple efforts and multiple attempts to get one person. Well, if somebody has any questions, I'm going to put my email in the chat. Happy to talk more, but also you can take a look at the recording and all of my information is there.
So thank you, Maria. This was wonderful, very informative, great information. Thank you and your team. Please do not forget to do our survey. The link has been posted. Kathy's going to throw it out. We will find you, ask you to complete this survey over and over again. I just want to remind people that we have another series being presented next on April 12th, and we hope to see you all then. Thank you.